Okay, I think we're ready to begin. Welcome everyone. My name is Christy Wooten. I'm the president of the Atlanta Press Club. I want to thank you for joining us today for our online newsmaker event as we welcome Grady Health System CEO John Haupert and Amber Schmidtke, PhD, to answer your questions about the COVID-19 response in Atlanta and in Georgia, mask usage, and more. So during this unprecedented pandemic, online events such as these allow us to engage experts and top journalists in discussions about the impacts of COVID-19 upon the health and livelihoods of not only journalists and our membership, but people from all walks of life. I would like to remind you today that if you have any questions, you may go to the chat function at the bottom of your screen and enter those, and we will certainly try to get them answered. We want to thank you today for supporting the work of the Atlanta Press Club by joining this webinar. Please visit atlantapressclub.org for our upcoming events, to sponsor an event, to join as a member, or to donate to the club. Today we are excited. We've asked Rose Scott from Atlanta's NPR station 90.1 FM WABE to moderate the program. Her radio news magazine, Closer Look, has become a signature broadcast for our community and brings together viewpoints from all sectors of society. For more than 2 decades, Rose has covered education, minority health issues, Atlanta's historically Black colleges and universities, gender issues, and more. Her reporting about Atlanta hip-hop artist T.I., "This Is Where I'm From, The Transformation of Tip Harris," received national attention recently, and she has won many awards, including Southeast Regional Emmy, Edward R. Murrow Award, and a lot of Atlanta Association of Black Journalists Awards, and numerous Georgia Association of Broadcaster Awards. So welcome, Rose. Thank you.
Thank you. Thank you for having me. And thank you to the Atlanta Press Club. And, you know, of course, under what would be normal, this type of event would be taking place live somewhere. But as you know, we're in a new normal now, and we have been for about 7 months. But what hasn't changed is our job as journalists, and I believe with my colleagues in the WABE newsroom, regionally, nationally, and internationally, our job is not only to continue, bringing news and information as it relates to this pandemic to the masses, but also to seek the truth of the community. And this public health crisis, yes, it affects us all, and no one is immune nor exempt from the potential outcome or consequences of this pandemic. And that being said, the response and actions put forth to mitigating the transmission is of great importance from the national level to the state and locally. And that's a big part of today's conversation. And so we'll begin by welcoming John Haupert's Chief Executive Officer of Grady Health Systems. And now many of you probably have heard him in the news, or now we get a chance to go one-on-one with him. And he joined Grady in 2011. He's a board certified fellow in the American College of Healthcare Executives and a recipient of the Regents Leadership Award. And leadership is so key in a time of right now. And he has served on the board of trustees of the American Hospital Association and was the 2019 chair of the Georgia Hospital Association Board of Directors. So John Haupert, thanks for taking the time and joining us. I really appreciate it.
Thank you. It's a pleasure to be here and to be able to have time today. Amber's going to walk us through a lot of the statistics and the numbers and where we think those are headed, so I will not go there. But I thought it would be interesting to share with you the lessons learned from the hospital field through the COVID pandemic. It came on quickly, and it seemed like yesterday, but it was the second week of March that the first COVID patient was diagnosed in Grady's emergency department. Since then, we have treated over 1,000 patients now who are COVID positive. We are now coming off of the second wave of the pandemic in the Atlanta metro area, having reached a pretty significant peak in the number of patients that required hospitalization. At Grady, we have ranged anywhere on a daily basis of having 20 inpatients with a COVID diagnosis to 100 and almost 130 at this most recent peak. And so when you introduce an additional 130 patients that most likely would not have required hospitalization into what already is a very busy healthcare market here in the Atlanta metro area, we really end up pushing the capacity of the hospital significantly. At the peak, which was just 2 weeks ago, 87% of the hospital beds in Atlanta were full. We have a little bit of a concern, to be honest, about what will happen now that school is back in session, and so many kids are in person, and also what may happen over the Labor Day weekend. We know that Memorial Day and July 4th, there were a lot of mass gatherings. Those mass gatherings ended up generating spread of infection. And the smart people like Amber, who predict these kind of things, they can tell us what they think that peak will be, but some of the epidemiologists, infectious disease specialists that we work with are predicting that we could see a peak if people don't do what they're supposed to over Labor Day. We could see a peak, another wave with a peak that will require 200 additional hospital beds to what we just saw several weeks ago. So we would end up finding ourselves going from an 87% occupancy to a 90+% occupancy in the Atlanta metro area, and that's really, really pushing it. In healthcare, we've learned a lot through this. There's a lot of things that have changed and have changed for the better. Telehealth being one of those. We operate 6 very robust ambulatory care centers. Normally, we provide care all in person. Overnight, we had to switch that care delivery model to telehealth, either phone or computer, video. And Grady, at that point, did not have a robust telehealth network. We developed one and stood it up within a week, and are now seeing at least 10,000 patients a week via telehealth, 7 to 10,000 a week via telehealth. That's allowed us to maintain access to the patients and for the chronically ill. And actually, our patients are telling us they love it. They don't want it to ever go away. They want it to stay. And I think it's an incredible advancement in the way we do business. And then one last comment, and I think my introductory time is up. But the other thing we've learned is about PPE and inventory management. Hospitals years ago went to a just-in-time inventory model where we don't warehouse supplies. They're delivered twice a day from our vendors, and we have the supplies we need. But then if a pandemic hits and you have no backstock and things become scarce, you end up in trouble pretty quick. I think it says a lot for the local healthcare systems in this market, where we all came together and helped each other through that issue, and our manufacturers who really stepped up. We at Grady now have changed our position on that and are now building or are at a 90-day supply of those key PPE items, which has required us to create warehouse space to house that. But it's just too critical for us to be able to maintain the safety of our employees and staff, physicians, and our patients not to take that action. So back to you, Rose.
Right, but before we move to Amber, I do want to throw out another question to you, because the healthcare workers who have been obviously so important through all of this, can you let folks know how Grady Hospital has been able to help your own employees, your own healthcare workers, and what initiatives and measures you all have put in place to help the doctors and the nurses and
Sure.
the support staff?
Yeah, it has taken a toll for sure. The additional workload, number one, and then being faced with an unknown new virus that we weren't sure up front was going to cause harm to the staff or not, or what protocols were going to be needed. And so we really had to take a deep dive into making sure we were protecting people's safety. I've been at this a long time. I remember going through this same kind of concern and fear at the beginning of the AIDS epidemic. I remember this with SARS. I remember this with H1N1. I remember this with Ebola. And here again, our staff was faced with something that was unknown. And so we have done a lot to support our staff. Number one is having the PPE available and making a pledge to them that we would never put them in harm's way. Number two is providing unit-based or even individual chaplaincy support, psychotherapy support, group meetings, group discussions. We've helped supply and fill the childcare need that so many of our employees have through a partnership with YMCA. We have 800 families of employees here that are taking advantage of that. And one other that I will highlight, there's many other things we're doing, but one other is we years ago established an employee assistance program for employees who run into a difficulty financially. We have a program whereby employees donate for employees. And so we were able to build an account to be able to help our employees. Since the beginning of this epidemic, we have awarded or responded to 1,000 requests for help from our employees and have been able to assist those 1,000 employees with a total of $1 million so far in assistance. And it's anything from housing, food, childcare, you name it, the issues that come up, the number of stories that we hear every day of Grady employees whose spouses have lost their jobs, a single mother who may have 2 kids who can't go back to school, and so they have to be at home and go to school. And how do you balance that? And the child care costs that used not to be there. You know, the economic and societal impact of this is as big as the stress of dealing with the disease.
Thank you so much for that. And now we are going to bring in Amber Schmidtke, who is an expert in microbiology and immunology and a former CDC fellow and former assistant professor at Mercer University, who uses data and science to demonstrate the impact of behavioral change. And Amber, welcome to the conversation.
Thank you so much. It's a pleasure to be here.
Before you and I get into our conversation, I just kind of want to get your takeaway from the beginning to now in terms of how the data and the science has been helpful, but through your lens, is there something that's missing in terms of how we take this information and relay it to the society at large?
Definitely. I mean, what's been really interesting in watching this pandemic as somebody who can speak the language of both the public health profession as well as understanding the unique needs of non-scientists to understand that information is the awareness that our data are not perfect. We don't have complete tabs on how many people are sick or how many people have died from COVID-19. And so in a lot of ways, you know, we all want better data, but we're doing the best we can with what we have. But what I've really enjoyed watching is how people have learned throughout this time frame. And it's really been an opportunity for us to see how the scientific method plays out. And now the public kind of gets that refresher of how that works. I think if we went back to January and asked the typical person what a 14-day window of uncertainty was or a 7-day moving average, no one could tell you. But now people spit that out with no problem whatsoever. And so I think not only have we been learning more about the virus, but our society has been learning more about science and epidemiology and how to look at data once again. And I think that's been, I mean, if there is such a thing as a silver lining in a pandemic, I've been very heartened to see that interest and that desire to know and understand more.
Well, let's focus now on Georgia, because we know that this White House coronavirus task force, it reveals Georgia remains in the red zone with case rates and death rates that are still twice as high as the national average. And now it appears the cases are diminishing based on the data. But here's the thing, and this is something that was interesting. If testing capacity has improved in much of the state and the hospital beds are opening up, we know that, and the reported hospitalizations are currently at their lowest rate since July, that's all great news. And there's been a decline in hospitals that are reporting data to the federal government. And some may say, well, therein lies the problem. You followed the state's COVID numbers and you made your own data visualizations. You released a report this week. Why did you feel the need to do that? Particularly based on everything you just said about folks learning more about data and being able to understand it. So now you've released your own report.
Right. So in the early days of the pandemic, I think we all remember that the Georgia Department of Public Health was putting out information, but it was very rudimentary, and we weren't seeing day-to-day change or context over time. And so in the beginning, I was just trying to provide that context while they were, you know, I've worked in public health. I realized the all hands on deck mentality that's required. And in the beginning, it was really just my way to help. But as time has gone on and my work has taken on a broader popularity, I've sensed that, you know, there's still that gap in knowledge in terms of what DPH is able to produce and how a person is able to understand it. And so really the work that I do is allowing us to see a deeper context, whether that's how the cases are impacting people of different race and ethnicity, people of different age groups, and how things are moving over time. And so one person at one point compared it to like the sports center of COVID analysis, and that's kind of what my goal is here's what's happening and here's why it's important.
Well, let's talk about why visuals are so important now, because now we're going to show some slides, and if you could kind of take us through some of this of what we're seeing here. Now, these two graphics you've got here demonstrate the surge of new infections that have followed holidays, such as Memorial Day holiday, which can happen again with this upcoming Labor Day holiday if people are not being practicing safety measures. So walk us through this data right here, Amber.
So what you're looking at here comes from the Department of Public Health, and this is a graph of cases for the state of Georgia by date of symptom onset. So that means that, we may get, reports today, but we want to know when that person first started feeling ill. And so we backdate their case to when those symptoms first started. And so that's why you see that there's this grayed out space on the right-hand side, and that's called the 14-day window of uncertainty. And that's an artifact of how infectious disease works. We won't know who's sick in real time because of problems like incubation period, delays in getting a test, and when that test is reported back. Now, what this is showing is where we were prior to the summer surge. So looking at the day before Labor Day, or Memorial Day rather, which was the 24th of May, we had a 7-day moving average for our case count that was 665. And then at the peak of our summer surge, which was centered around July 11th, our 7-day moving average was about 600% higher at 4,363. And so what you see here is that things look okay until they are very much not okay. That's a function of exponential growth, and that's what we experienced during this summer surge. Something else to pay attention to is that while our cases increased very rapidly, they did not fall off very rapidly. So just understand that once those surges happen, it takes a long time to bring that disease transmission back to heal. So that's that. For this slide, what this is kind of showing us is how the pandemic moved during the summer surge. So when the summer surge began, it was around June 12th. And we first started, or June 15th or so, what we first started seeing was when it was hot spots develop along the Georgia borders, and especially the Georgia coast over time. And those are areas that are known for places that a person would want to go on vacation, for example. And because cases are classified based on county of residence, not necessarily where a person got sick, those are the locals that are sick. And so that's important for us to remember. And so in the early stage of these, the surge, we saw that concentration of cases along those border counties and the coastal counties, and then cases started moving elsewhere in the state. And so the concern is that people went on vacation, they went to restaurants and bars, had a great time, like we all want to do, and then they took the infection home with them and it spread within their local communities. And so that's really what we're trying to avoid by getting the message out for Labor Day. Is just a reminder to keep things small and keep things as contained and as safe as we possibly can.
So in other words, you're saying also as folks flock to maybe Tybee Island or down to Savannah, that this is where we saw those surges.
Right, and I think you can still go on vacation. You can still have, we all need that release right now. It's a very stressful time. I think we just need to be very deliberate about, supporting those local businesses, but doing so in a safe manner. And then, minimizing our exposures and transmission risks.
I want to move to the next slide in just a moment as we talk about the summer COVID-19 numbers in Georgia. And, we also, and I think John spoke to this when we first started the conversation, and talking about not just hospital beds, but also those folks who require more than just staying at home and resting. So we talk about adult ventilator use in Georgia between May and August that has reached a plateau, but is yet to make a big downturn. And this death rate, which lags between the infection rate by 2 weeks or more, which what you talked about, went from an average daily death count of 19.4 on July 3rd to 51.6 on July 27th, Amber. That's 166% increase.
Right. Yeah, I know it's hard. I mean, we have lots to celebrate right now in terms of the fact that, current hospitalizations are declining, new hospitalizations are declining, and this is across the state. We are seeing gains in ICU beds, as John pointed out, and adult ventilator usage too. But it's important to note that while these declines are happening and they're great, and I'm really happy to see them, we have not yet reached the baseline that we were at prior to the start of the summer surge. So while they are decreasing, they are still very, very high. And we need to be very careful because the momentum that we have built since the summer surge to try to curtail the spread of illness, that can turn very, very quickly if we're not careful. You're right that the deaths are going to lag behind our case surge. We haven't yet started to see deaths decline in a big way yet. And that's deeply unfortunate. So I'm hopeful that we'll start seeing those numbers start to decline. But as John pointed out, everybody's really nervous about what happens now that we have reopened schools and reopened colleges and universities.
Amber, I have one more question for you. And actually, John, you can chime in on this too, because when we talk about using the data and the science to hopefully spur positive behavior in folks, that's something you can't mandate. You can't control folks' behavior. But what are you hoping that with this weekend, this last summer holiday weekend, that there is enough science and data out there that people will change their behavior and their habits? And if it begins with wearing a mask, then I guess that's a big win.
Yeah, so I think one of the unfortunate things about public health is it doesn't matter to a person until it matters personally to them. When they know somebody who's sick, it will have a more dramatic impact than seeing the data on a screen. I have to remind myself that I'm not everybody's mom and I'm not everybody's boss. I can't tell them to stay home. I can't tell them to do these things. But I think the data are compelling. Seeing the way that disease, hospitalizations, and deaths all surged after that Memorial Day weekend, I think Georgians are tired. We don't want to keep going through this roller coaster over and over again. And especially knowing that, influenza season is right around the corner, it's just that much more important for us to continue to do the right things right now. So I'm hopeful that people are getting the message to keep things, you still have fun, but do so in a careful manner.
John, what about using science and the data to hopefully spur behavior change? Through your lens, how do you see that? Unmute yourself, John.
It's very unfortunate that some of this has become politicized because we do know how to curb the growth in new cases. And Amber's exactly right. What we've seen the source of so many new cases being is large group gatherings, more than anything, and not proper use of masks being another. But there's also some other elements that enter into that. There are some folks who, if they don't go to work, may not have a job. If they don't go to work, there may not be any income, and so they may not feel well when they go to work. And that's a much more difficult situation that they may fully understand the science, but that's a life issue for them. I think for the most part, though, Rose, what we are seeing is what Amber said. Until it touches you personally, it's someone else's problem, and it doesn't really bring it home. I think part of the reason we're seeing the curve come down again is I do think that a greater portion of society is understanding this just isn't going away. And if we don't do something about our behavior, it's not going to go away. And I think so, I really do see more uptick in people understanding the science and heeding it.
Well, let me stay with you for a second, John, because as a leader of a health system, how important has it been, the role that you all have played, and not just here, obviously, in the Atlanta area, but even across the nation, the role that the hospital systems have been able to play in getting this information out to folks. And let's be really clear too, and Amber, you can weigh in on this as well. Sometimes there's a conflicting message between what may be coming out of Washington or what may be coming out of the governor's office. So how do you navigate through all that?
We feel at Grady, and together we've come together with all the other health systems in Atlanta to be quite vocal about wearing a mask, social distancing, washing your hands, and reiterating what we know will bring this case rate down. We collectively try to avoid the political side of it and stick to the science and educate our patients and our outpatients and our folks in our ambulatory centers and our communities about what they can do to stay safe, and focus on what we can do to prevent additional infections, rather than jumping into the political pool.
Well, Amber, let me ask you about that political pool that John just talked about. There are conflicting messages sometimes, and if you're just, and as a citizen, you don't know what to believe. You know, how do you? What do you tell people? Let me ask you this, Amber. Have you had conversations with people that say, "Well, it's just a really bad flu. It's not that big of a deal"? Have you had to have that conversation with folks?
I have that question a lot, or that comment a lot. And, you know, if we look at, even if you look at, you know, like I said, we have imperfect data. And so one way to see around that imperfect data is through looking at the impact that COVID has had on our death rate this year compared to previous years. And even in our worst influenza season that we had in recent history, which was 2018, we did surpass what was considered the normal threshold of deaths of all causes. But it was an intense burst that was short in duration. With COVID, since it has arrived, we are both well above that threshold and for a sustained period of time. So there's really no comparison between the two. Like you pointed out, I think people are getting conflicting messages, and that can be very confusing. One of the things that I look at a lot is the differences in the way that the disease is moving in urban locations as compared to rural ones. And our rural counties are especially having high case and death rates. And part of it is because they don't have the sources of information that you might see in an urban setting. And that's really a place that I think that we need, really clear and non-conflicting information coming from our government, because they are the authority in many of those environments where maybe the press doesn't have as big of a role to help get that word out for us. So I think when we're looking at, if you're a person in a rural community and your local leadership is trying to enact a mask mandate to prevent the spread of illness in your community, but at the same time you're hearing leadership at the state level say that a mask mandate is unenforceable, it's really hard for an individual to understand where they're supposed to wear a mask and where they're not, or if the neighboring county has a mask mandate but they don't. And so in that sense, we really need a unified strategy when it comes to some of this.
Well, and then also let's talk about safety measures, because, early on we heard, okay, you wear your mask, you have this type of mask. And then now we hear, well, this type of mask doesn't work. And some people say, well, early on they said only older individuals and folks with, compromised illnesses, they're most at risk. And then we heard young folks, they weren't at risk. And then we saw what happened when everyone went down to Florida. And now we're hearing that young folks, and then we're hearing folks without any condition. So when folks hear all that information, it can be confusing. As a scientist, Amber, let me ask you this. What has been complexing about this coronavirus? Because one could say, we really don't know who is in a high risk population.
It seems like it's been forever. I have to remind myself that this just started in March. And we're relatively young in this pandemic still, in terms of understanding how the virus works, what the routes of transmission are, risk factors, and vulnerable populations. So yes, there has been some shifting in our knowledge and awareness of how, which masks are best. And honestly, a lot of our guidance in the beginning was to try to preserve that critical PPE supply that we knew was going to be constrained. Guidance has shifted over time as we've learned more, as we've been able to build capacity. And so, yeah, I think in many ways what we're seeing is the scientific method play out in real time. We're seeing self-correction within science. Like, as we learn more information, we change our perspective or we change our strategy. We are seeing that, yes, typically the people that are most impacted by severe cases are the old or the frail, but we are also seeing significant heart conditions, even among the young. I read a report that just today that in the Big Ten conference, 30% of their football players have endocarditis right now who had COVID-19. That's concerning. I mean, that's a very high rate, and this is even among asymptomatic cases. So you're right, we're kind of in this weird spot, and it's kind of frightening, honestly, to think that you could be completely healthy, but then have some of these longer term impacts.
And Amber, and I hope you can answer this question, because early on we heard if you contract the virus, you cannot contract it again. And then we heard, I think maybe a week or so ago, about someone who might have contracted the virus a second time. And then someone said, well, that's probably highly unlikely. What do you know in this area about being able to contract this virus for a second or even a third time?
So we've been getting reports of this for months now, different stories. And for a while it looked like, well, that could just be reemergence of an existing virus that was already in their system. One of the ones that came out recently for a gentleman in Nevada, he had a genetically distinct virus the second time around, and he had a worse disease course. He actually required hospitalization the second time. And so for that reason, it is suggestive that perhaps he did have a true second infection with the virus. He didn't have any underlying conditions that could explain why you would see him ill again. And so the question that really what that brings up is, well, how long does the immune response last? And so that will have important implications when it comes to the vaccine development, but also the strategy that some are advocating for of just achieving herd immunity through brute force. If we can't achieve lasting immunity from natural infection, and we really need to have that vaccine on board, then that kind of throws that strategy out of the window. So we'll just have to kind of see how that goes. But so far that seems like it's not super common, but again, we aren't really looking to see how many people are getting second infections yet.
Well, now we come to the part where I can stop talking and we actually get some better questions probably from some of my colleagues. Let's start with, it's a question from Jeff. He's an AP reporter, Jeff Amy, and he wants to know if y'all know how many people have gone through the temporary hospital at the Georgia World Congress Center since it has become a facility, an option. Does either one of you know?
Yeah, so Grady is the one of the operators of the Georgia World Congress Center. It is a Grady facility. And this go-round, during the second peak, the Georgia World Congress Center site has been able to take on more acutely ill individuals, people requiring IV therapy, oxygen, needing heart monitoring. And so it has been much more widely utilized than it was during the first peak. And so they are beginning to see their census decline as the rest of the hospitals have, but they have had as many as 42 to 45 patients there as inpatients in that facility. And they have come, a lot of them have come from Grady, but they have come from the other local health systems and even from across the state, from hospitals that were needing relief capacity-wise. It's really been a valuable asset as we've gone through this second peak in the state.
So John, do you know how close the state's hospital system came to capacity during this peak at all?
Statewide, I'm not 100% sure. I do know that Atlanta Metro, when we started getting between 83 and 87%, we became a little bit concerned, and so we weren't near capacity. I think one of the things Amber touched on, that in the second peak, while we were seeing so many more inpatients and so many more people requiring hospitalization, we weren't seeing a significant percentage of those patients requiring critical care services. And that is due to the ever evolving emergence of therapeutics to assist in the care with remdesivir and steroid usage. We really have seen where those therapeutics have reduced the length of stay and brought down the severity of illness that we saw during the first wave.
And John, let me stay with you for a moment, because Jeff has a follow-up question in that there was a lot of talk about people delaying routine medical care since this pandemic began. But through your lens, are you seeing that at Grady? And what do you think the long-term impact will look like for those individuals?
Yeah, that is a significant concern. You know, that when the shelter-in-place order was initiated, we purposely restricted, quote, elective or essential procedures, but even the use of the local emergency rooms plummeted to about 50% of what it once was. And well, actually 30%. And right now, the ED volumes in the local hospitals are nowhere near what they were pre-COVID. And what that tells us is that there are people who used to come to the ER, appropriately come to the ER, and needing care that aren't now. One of the reasons we moved so quick to stand up a telehealth network with our ambulatory patients was to make sure we maintained care for their chronic illnesses and that their chronic illnesses would not get out of control. We are seeing here at Grady people coming to the ER that are obviously in worse shape than they would have been if they had come earlier, and are communicating to us that they had avoided wanting to come in contact with a hospital. And we do hear nationally that is a byproduct of this pandemic.
Here's a question for both of you, and we kind of touched on it earlier, and this is a question. Listen, are some types of masks better or more effective than others? And I'll let you start with that one.
Okay, so you know, in the early days, we didn't think that masks were really necessary unless you were a healthcare worker or in one of our vulnerable categories. That has changed over time. I think the very best kind of mask you can wear is an N95. They are a bit uncomfortable, hard to breathe through, and they really have to be fitted to your face to be very effective. But as we are seeing evidence that airborne transmission is a possibility, that's the kind of mask you want if you're going to be in that high-risk situation. I still don't know where we are, and maybe John can speak to this about, how big of a supply do we have of those right now, or is it still best to set those aside for our healthcare workers who need them desperately? Or, is that something that we can use routinely as ordinary citizens? I will say that cloth masks, you want to just make sure that it's nothing that I really like this example. I think Bill Nye, the science guy, put it out, where you should not be able to blow out a candle through the mask that you're wearing. So that it should be usually a 2-ply cloth in order to achieve that. But if you wanted to test it to see how well it's working, we just don't want that to be able to blow out with enough force to be able to blow out a candle. So I think that's kind of, no mask is better, or a cloth mask is better than no mask. And I've seen some evidence from CDC lately that we want to maybe avoid things like neck gaiters or bandanas. They just don't seem to be quite as helpful as some of those other 2-ply masks. But John, go ahead.
Yeah, no, Amber's exactly right. Regarding the question about the availability in N95s, I don't think the supply of N95s is at a point yet where they will be available in mass quantity for general use. I believe that will catch up, but those still are being viewed as top priority, being for direct caregivers.
Well, and what about the face shields? Because early on we heard folks talking about how effective the face shields were. Now there was a report the other day on the news that said perhaps, with the sneeze, there is a possibility that the droplets could go up under and still be transmitted out into the air. John, what do you make of that? What are your view on the face shields?
Well, I think face shields in our environment have been incredibly helpful and greatly improved safety for our patients. I have heard those same reports, Rose, and can understand how that could happen. I think that would be fairly unusual, but it could happen. But I know that we have, particularly in the long-term care environment in nursing homes, where the caregivers are in close proximity to patients, we have decided that a face mask and shield are what we can do to best protect the elderly patients in our long-term care facilities. And so I think there's far greater benefit to a face shield than there could be any downside.
Amber, your thoughts?
I think I would just caution people to still wear a mask with their face.
Oh, absolutely.
like John was saying, because if the evidence continues to accumulate that airborne transmission is a real route of transmission for COVID-19, then the face shield is more or less like the plexiglass that you see at a salad bar. It's there to keep you from spitting on things, but your airborne droplets are still going to be able to move around that. So I think that would be my only thing to add. Would just make sure that don't assume that it's a Superman's cape kind of thing. You need to probably be more protected than less.
By the way, let's be really clear. I think the days of the buffet are going to change.
Yes.
Just so everybody knows, that's going to look really different in the future. Here's a question from someone out there that says, look, Atlanta's viewed as a center for global health. Think of all the medical institutions that we have here. Think of the CDC and other leading health agencies. And I think this is a great question. What could Atlanta and Georgia have done differently in their response to COVID? Now, that could be a holistic answer, if y'all don't want to get political, but considering where we are, what we represent in the medical. And you've mentioned the Ebola response, John. I mean, Atlanta played a huge role in that, in Emory University, but what could we have done differently, you think, in response?
I think Amber wants to answer that first.
Oh, okay.
I think we could have benefited from a longer shelter in place. We know that those sorts of interventions work. We saw that happen in the 1918 pandemic when that was really the only technology they had, and face masks and things like that. So I know that it was hard for us to shelter for 3 weeks, but I do wonder where we would be now if we had been able to shelter for even 2 or 3 weeks more. I don't know that we have the political will in this state to issue another shelter in place order. So I'm hopeful that maybe we could compromise and get like a mask mandate so that we can at least still function and do things as a society. I'm just kind of disappointed in some ways because it feels like we've lost our sense of community-oriented mindset. We have a lot of people that are sort of like, this is somebody else's problem and I need to take care of myself. And that's really unfortunate and hard to watch. And it's hard when you're a parent to try to model that kind of community-oriented behavior and then not see that playing out in your community.
I think that it's a difficult question. I agree that shelter in place longer would have helped. I think higher compliance with mask wearing as we came out of that and coming out of it a little more gradually could have helped. But at the end of the day, I think we were all pretty shocked at how quickly the economy cratered with the shelter in place orders. And was that totally avoidable? Absolutely not. We had to take some pretty drastic measures to prevent the infection from really just running wild. But I think there is a magic point at which we balance economic viability and public health, and we can't sacrifice one for the other. And as we came out of shelter in place, it was a bit shocking to see the number of individuals choosing not to comply with the CDC recommendations around masking, distancing, washing your hands. Pretty basic stuff that, I don't see as an infringement on someone's personal freedom. I see it as a way to protect each other and to serve each other in a community. And I wear my mask to protect you and me, and hopefully you'll wear one to protect yourself and me as well. And that's where I think we kind of got off track. But I also, at the same point, am not an individual or a health professional who says, let's shut down the economy for 9 months and see what happens so that we can get to zero. That's just not a viable option.
Well, I think now we are going to take some time to get some questions from the audience. That's correct?
So we've got one here that I don't believe that has been answered yet. Is there a concern on the financial side for hospitals even after the pandemic has ended? I know we kind of touched on this a little bit, talking about volume and people, the 30% less in the emergency rooms, I believe you said. So will a large increase in uninsured patients impact metro hospitals differently after the pandemic, or is that, and maybe Mr. Haupert, you can answer that one.
Sure. So, the initial shelter in place and the elimination of elective and essential procedures had a tremendous negative financial impact on all hospitals, and quickly. I think we were probably all kind of shocked at how quickly that happened. The CARES Act funding that came through the federal government has provided much needed relief. Because of the methodology utilized in each of those different payments by Health and Human Services, each payment was based on different criteria. So you don't see consistent recovery from hospital to hospital. It's not as if all hospitals have been compensated for 50%. The percentages vary, but that CARES Act funding, I will say, for the most part, the CARES Act funding saved the day for hospitals coming back out of that period and recovering from that. A number of individuals who truly were scheduled for what you would call a real elective procedure have chosen not to have those. They're going to wait to do that for another day. A lot of things are called elective that really aren't elective to the person who needs it, who it's a cancer-related surgery. It may not be life-threatening, but it is life-improving or pain-reducing, and we do see those patients coming back. I think the long-term impact of lower ER volume, I am concerned that will contribute more toward exacerbation of chronic health conditions such as heart failure and COPD, diabetes. Not emergently ill people. And then the question about the uninsured is looming. You haven't heard a lot about that in the press, but with so many people losing their jobs, so many people losing employer-sponsored benefits, it only stands to reason that we're going to see people who formerly were insured no longer insured, and the percentage of uninsured increase.
I want to throw this question out for you all too, because you touched on it, how important this weekend is, this Labor Day holiday weekend. Amber, when would we start seeing the results of that, and it may be an increase in confirmed cases? How long is it? Is it 14 days? Is it 3 weeks? What are we looking at?
So I mentioned earlier that, you know, we have that 14-day window of uncertainty, and that is because of the incubation period of the virus. And, you know, a person doesn't get a test right away. They may think it's allergies or a cold, and then it takes a while for the test to come back. So honestly, what I keep telling people is it's the things we do or don't do today that are going to impact cases 2 to 3 weeks from now, because we won't know that a person is sick until about that time, at the state level anyway. And so I think that we would probably, if we're going to see this, we're going to see it in like the third to fourth week in September. The thing that's going to maybe muddy the waters a little bit is that we've also been reopening K through 12 schools and colleges and universities leading up to this. And so the question is disease transmission gaining enough momentum on a community level that, you know, we've sort of already started the fire and Labor Day just throws more wood into it. You know what I mean? So.
And let's be a little clear. I love sports. High school football here in Georgia kicks off, I believe, tonight or tomorrow. College football. Look, let's be really clear. It's going to be hard to social distance, you know, at a college football game, but how concerning are you of that? Because we are going to start seeing large groups of folks, you know, all in one area, in one event, you know, at a stadium or even at a high school football game. How concerning is that for you all? John?
Yeah, go ahead.
Yeah, we're very concerned, and I think Amber would say the same. You know, there have been a number of large mass gatherings where there wasn't a high utilization of social distancing or mask wearing. You know, we've seen cases now being generated out of Sturgis. We've seen cases coming out of political rallies. Weeks after the rallies or the events, we've seen big house parties. Where we saw one here in Atlanta where there were several hundred people at a house party, and the cases have come out of that. So you're pretty much guaranteed wherever there's a large mass gathering without use of mask or social distancing, there are going to be spreader events that come out of that. You know, one of the other phenomenon we're seeing is that because for the most part, younger individuals are less susceptible to infection and or severity of testing positive they may test positive and remain asymptomatic. We have begun to see cases where that individual then introduces that to family members who do become quite ill. One of the more tragic I've seen is a 30-something who did not think they were doing anything that was high risk behaviorally, but was asymptomatic, did not know they were positive, but brought that home to their mother and a brother who had significant comorbidities. And both the mother and the brother ended up passing away from COVID. And those are the kind of issues we're trying to avoid through the mass gathering. Yeah, everyone wants to go to the football game. Yeah, if you're a 21-year-old college kid on a college campus, you're going to act like a college. We were all there one day, right? We were there in the past. We understand that, but it's what happens with that as that exposure and that positivity that occurs in those environments spreads to other environments.
I want to end because there's something we haven't touched on. I want to make sure we get to this, and that is, depending on whom you ask and whom you believe, there could be a vaccine at the end of this year. Amber, your thoughts about that and concerns you have?
I am concerned. I follow the process or the stage of the different vaccines. The New York Times actually has a really helpful tool for tracking which vaccines are where in the process. I'm concerned that we don't have, I'm concerned that we may not have enough data on some of these vaccines to deploy them within this year. I think that, there's a delicate balance that needs to be achieved, that we develop a safe vaccine. And it's important to remember that it's not just the COVID vaccine that's on the line here. It's really important to maintain public trust in the vaccines, their quality and their safety, because it will have ripple effects on every other vaccine that we have for preventing illness. So it's really important that we get this right and that we do the process. I know that we're expediting a lot of things, but we still need to check all the boxes. And so that would be my concern.
Trying to get the last word on this.
On that same issue, back to something you said earlier, Rose, is that we are blessed in Atlanta with the amount of science and higher education that's here between the CDC, the universities, Emory School of Medicine, Morehouse School of Medicine, and the research occurring in those environments. When you go to all of those sources and talk with the scientists that are involved even in the trials of these vaccines, and Grady and Emory are two of the test sites for the Moderna vaccine. I never have heard one of them say, let's race and get this out ahead of the science. Because number one, you want to make sure that the vaccine is not going to cause harm. And you need to have gone through all the steps of the trial to do that. And back to Amber's point, how trusting is society going to be of a vaccine that was rushed to market and did not go through what is known to be the scientific process to prove its efficacy? I'm not so sure I'd be in line, to be honest, for that. I will be one of the first to be in line when a proven vaccine hits the market, believe me. I very much think vaccination is important. And so I think that's a delicate one too. And I just don't see how one of those is going to be in the market by the end of this year. I don't see how that could happen.
I think I'm going to jump in with just one more question, Rose, if you don't mind. There's a question from the audience about COVID testing, and I know we've mentioned but not really touched upon that in this conversation yet. What people should do in general. We're talking about, cycles of where tests are available, but some are rapid and some are the longer ones in the lab, and people go 3, 5, 10, 12. I know for someone I know, they waited 16 days to get their results. Where are we with that just in general, and what is sort of the forecast for the future of testing over the next several weeks? If you know that information.
Amber, you want to do that?
I can try. I don't know what's going on within the Grady system, so John will have to address that. But yeah, so if you have been in a situation where you think that you've had a risky exposure, say you went to a gathering this weekend, of course you tried to keep it small, but you're still just, want to make sure. We recommend that you wait about 3 to 7 days after that risky event to go ahead and get the test. The reason being is that The virus will go through what's called an eclipse period when it first enters the body, where it sort of hides out inside of your cells, makes copies of itself, and during that time it's undetectable. And so if you're going to go get the diagnostic PCR test, which is what's used as the gold standard for confirming a case by the state of Georgia, that's the length of time that we would recommend. The other test, the rapid test, if it's the rapid antigen test, that's interesting for knowing what your exposure may be, but it's not being used to confirm a case by the state of Georgia right now. So if that's important to you, then you want to go ahead and push for that diagnostic PCR test. But maybe John has more to add.
Very similar in that the more high risk the exposure is, if you know that you've been exposed, and you may be someone in a high-risk category, you need to get tested. And you want to go somewhere where you know you can get that result more quickly than in a 4 to 5 day period, because 4 to 5 days may mean, difference between hospitalization and not for you. If you're just curious and you want to test because it's out there, then it makes sense to go to one of the state-provided testing sites, and it would probably be okay to wait 4 to 5 days. But if it's been a high-risk event and you're a high-risk individual, the sooner the better, I say.
Let me ask y'all this. Should folks get a flu
Amber?
shot? Oh.
I was just going to say that's absolutely right, and I'm glad you said that. The other thing I would just point out is that if you have enough suspicion within yourself to go ahead and seek out a test, please plan to self-isolate while you're waiting for your test result. If you were moved enough to go get that test done, that means that you think that you have a realistic chance of having been exposed. So going back to that community mindset, please treat this as though you do have it until you are told otherwise.
Should folks get a flu shot?
Absolutely.
Absolutely.
100%. We need this to be the very best year we've ever had for influenza vaccine.
All right. Christy?
Well, thank you so much, everybody. We thank Rose Scott for moderating the conversation for us today. And a special thanks to John Haupert and Amber Schmidtke for participating. Great information. Please note that this event will be available to view online later. And please note that if you want to learn more about the Atlanta Press Club, you can visit our website at atlantapressclub.org, where you can join as a member, make a donation, or see the list of upcoming events. Great information, everybody. Thank you so much for being here, and thanks to everyone who's watching. We appreciate it.
Thank you.
Thank you very much.
Thank
Bye, everybody.
you.